with the fact that the whole world, almost the whole world, let me say, they're on a lockdown, the numbers are still increasing. I woke up to 1,095 thereabout cases. And then I was asking myself, I think I asked Chief this morning, so I said, what are we not doing right? What is it that we need to do for the numbers to decrease, to reduce? Because I don't know, man, it just still they appear like a dream. I don't know when all of this is gonna be over, but I'm not a health practitioner. I am a journalist. Okay, so we've got Dr. Bat as always every Saturday here, and just like what we said, we'll be giving us updates, we're telling you guys measures to take, and maybe you will just tell me this morning what we need to do that we've not been doing for these numbers to come down. Doctor, good morning.
Yeah, good
today.
morning.
How are you doing, sir?
I'm fine, thank you.
How is the family?
I'm happy to be back today. Good morning, viewers at home and around the world. This morning we'll be continuing with the talk of the moment. Coronavirus pandemic. Coronavirus pandemic. But this morning we'll be laying emphasis on how it concerns us most. Talking about Africans, how it concerns us most. Just like what she rightly said at the beginning, we all woke up this morning to discover that Nigeria has gone over 1,000 cases. As a matter of fact, we now have 1,095 cases of infected individuals. And about this time last month, I was just trying to make a comparison. We had just 42 cases at about this time last month. We had just 42 cases. So you and I can see the exponential increment that we have seen in just about a month, a period of 1 month. What will it be by this time next month? Your guess is as good as mine. And on that note, I want to first of all start by commending Nigerians. The lockdown, it's not funny. A lot. It has taken a lot of toll. It has taken a lot of toll on us as individuals, on us as communities, on us even as a country, economically and otherwise. Yes, I must appreciate the government for making available some form of palliatives, but it's hardly enough. And I don't also think it has gotten to virtually everybody. It may just be a drop in the ocean, but it's worth commending, okay? Not just the federal government, the state governments, all the responses that we are beginning to see is just one response that has cascaded down the whole states and is commendable. I must also appreciate my own constituency, the healthcare professionals who have been in the front line in this court.
You guys are the real VIPs.
Yes. Somebody described us as the last line of defense. It doesn't matter where you are. Once you're a doctor, you're in the front line. Because this is fast becoming a guerrilla warfare, I must be honest with you. Even those of us in the private practice will tell you this. Just about less than a week ago, Lagos State government actually gave an analysis of the number of deaths that occurred in Lagos. And at a time, they said out of 14 deaths that occurred in Lagos, 12 of them were actually in private hospitals. Surprisingly so, too, this set of hospitals are not permitted, except if the hospital has an accreditation to actually treat COVID-19 patients. But how come we had 12 deaths out of 14 in this set of hospitals that we were told, that we were warned, that are not permitted to treat COVID-19 patients? What does that tell us? Are you a policymaker? Are you listening to us? What it tells us is that people have their preferences. What it tells us is that we should make effort to at least give people the benefit of making choices. A lot of elites, try as much as you can, may never go to the government centers for treatment. That's the sad truth. And that accounts for the high rate of community transmission cases that we are beginning to see all over Nigeria. I also want to say that the figures we are looking at may truly be higher than this. Because I can tell you that Kano State, for instance, for a number of days now, for a few number of days, they've not reported any cases, ostensibly because of the challenges that they have. The ACDC lab or center in Kano, they had a number of lab scientists or workers there who were said to have tested positive, who were said to have been infected by this scourge. So they had to actually take them into isolation and then do the necessary decontamination, which of course will take some days before they will start all over again. So by the time their cases start trickling in, we're expected to have a higher figure than what we presently have. That will also take me to the statistics we have for the whole of Africa at the moment. Okay? At the moment, South Africa is still the top on the list. South Africa happens to be the top on the list, followed by Egypt. Okay? Yes. South Africa has a total of 4,220 cases. Next to South Africa is Egypt with 4,092 cases. And then you have Morocco with 3,758 cases. And Algeria, 3,127 cases. Cameroon, 1,430 cases. Ghana, 1,279 cases. And of course, Nigeria, 1,095 cases. Ivory Coast, 1,077 cases. And you look at the number of deaths. So far, total deaths in Africa stands at 1,328. And Algeria suffered the most in terms of fatalities. 415 people have died in that country. Next to Algeria is actually Egypt, where 294 persons have died. And then you have Morocco with 158 persons losing their lives. And South Africa has just 79 fatalities. So they've done wonderfully well. And of course, Nigeria at the moment, we have 32 fatalities. 32 people have lost their lives. Despite the fact that South Africa is topping the list, among the 4 highest, in terms of number of cases, countries that have the highest number of cases, you still can see that South Africa has the lowest number of fatalities among them. The number of people who have died, 79. And that speaks volume about the healthcare practice in that part of the world. That takes me also to the fact that South Africa may have put in more effort, more than any other country, or the results that are coming in from South Africa have been very fantastic. In spite of the high number of cases they have, they've been able to do so well, and they've been able to limit the number of fatalities they have in that part of the world. What does that mean? For instance, in terms of testing, South Africa has so far tested over 100,000. And of course, our neighbor close by, very close to us, a neighboring country to us, Ghana, if the records we are getting from there is anything to go by, they've also tested about 68,000, close to 70,000. And of course, Nigeria, if I take the WHO joint media briefing that happened 2 days ago as a yardstick, where a journalist from one of the African countries asked the Nigerian representatives, made of the national coordinator for PTF on COVID-19, Dr. Sani Aliyu, as well as NCDC Director General, Dr. Chikwehe Kwazo. Someone asked them, how come South Africa has tested over 100,000 and Ghana tested about 70,000 and Nigeria is still struggling with about 10,000? And of course, they pointed out the challenges that we have as a country. So one of the reasons that Dr. Chikwe actually adduced was the fact that South Africa, because he had the benefit of having worked in that part of the world for some 3 years, according to him, so they had structures on ground that they could build upon. That helped them tremendously. But for us Nigerians, according to him, we have to start from the scratch. But that is hardly enough. I must commend them for they've done so well. Okay, but we are asking for more. We need to step up what we are doing. Because from what is going on, if we're able to step up our the number of cases that we can actually screen in a 24 hours, that will actually enable us to discover more people in the community, and invariably that will lead to controlling the upsurge of community transmission, which everybody is beginning to battle at the moment. It doesn't matter where you are as a healthcare professional, COVID-19 is not written on anybody's face. Anybody can present in any hospital in Lagos or any other part of the country with symptoms that are typical or related to COVID-19. And of course, as a healthcare professional, the best you can do is to have a high index of suspicion, do your triage as the patient is coming in. But you don't have the benefit of having a test, having such a person tested until after 48 hours. Okay, so that's a challenge. And of course, that is part of the reasons why healthcare professionals, especially those of us in the private practice, are constantly being exposed to dangers. Coupled with the fact that we are not we are the least equipped in terms of having the PPE and other safety gadgets that we need to do this work. So government needs to come to our rescue, because we see more of those patients than even the government centers. Yes, that can be debatable though, but that is a fact. So essentially, what is coronavirus, and of course, how is it transmitted? For people who may not have listened to our discussion before, coronaviruses is a large family of viruses. COVID-19 was the latest trend that is currently causing or ravaging the whole continent, the whole of the universe at the moment. It's emanated from China, that we already know, okay, from a city called Wuhan in Hubei province. That was at the beginning, towards the end of last year. That's why the word COVID-19 is there. If it had started in January, it probably would be COVID-20. Okay, so it started in 2019. And 5 months after, you can see the degree of havoc it has caused in the whole of universe. At the moment, over 2.8 million people have been affected globally. And it has caused nearly 200,000 deaths. More than 198,000 people have lost their lives. And of course, the worst hit country of the world as we speak now happens to be the United States of America. At the moment, America has the highest number of affectation. They are almost hitting US at the moment has a total of 925,232 infected individuals. That is just about 1 million. And the death toll in the US at the moment, as of yesterday, is about 52,193. 52,193. And next to US is Spain. They have the number of individuals affected in that country is 219,764 persons. And next to them is Italy with 192,994 individuals infected with COVID-19. And in terms of the number of deaths that were occurred in these European countries, Spain, 22,524 people have lost their lives. And of course, in Italy, 25,969 people have lost their lives. And that speaks volumes on itself. So it's a disease that has caused havoc on a global scale. And I'm happy that the world are beginning to rally around WHO. There was a virtual meeting that happened yesterday. A number of countries of the world participated. Our own Dr. Konjo-Iweala was one of the special envoys to that meeting. It was a virtual meeting where the world have agreed to come together, okay, to look at what can be done to help nations of the world, especially Africa. Earlier this morning while I was preparing, I was stunned when I read a story that about 10 countries in Africa at the moment still do not have one single ventilator.
10 countries.
10 countries, about 10 countries do not have one single ventilator. And I remember that someone asked Dr. Chikwe Kwazo on that joint media briefing by World Health Organization that happened about 2 days ago. How many ventilators do we have in Nigeria? I think Dr. Sani Ali was the person who took the question. And of course, he said before this pandemic started, Nigeria had about 350 ventilators. But
Charles
about
Street.
100 may have come in the course of this struggle. Okay? And also he went further to say that more than half of, most of these ventilators are actually with the private sector. Does that not make a case that private sector should be co-opted into the fight? Of course it does.
Okay.
Thank you very much.
All right, so I think it's safe enough for us to go for this quick break. Of course, I know you guys have your questions on ground already. When we come back, it will be time for us to open the phone lines. Of course, Dr. Bat is still very much in the building. Take your questions. Open the phone lines, ask your questions, and of course, we'll be talking more on the pandemic, COVID-19. Stay with us. We'll be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Wet your hands with water. Apply soap. Rub your hands palm to palm and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Okay, obviously I've got my marks on and she was just trying to enlighten us on how to wear it. Which part of the mask supposed to face front, which one supposed to face your mouth. Okay, but I sure say countless times on the show, Dr. Bad don't already teach us on how to wear the mask. But I'm going to open the phone lines right now so that you, the watchers from any part of the world, you can have the opportunity to call in and ask your questions. 08105434984. And of course, 08173147589. Please help us turn down your TV volume, or just as you're trying to call us, so that you can be as audible as you can. Okay, so I think I should start from myself. Doctor, you gave us some facts and figures. Of course, talking about Africa with SA topping the list, Egypt, Morocco,
Yes.
Algeria, and of course, bringing it down to we own very own country, Nigeria. Now, I want to talk about the management and the fact that I don't know what SA, I don't know what they've been doing to curtail or how they've been able to manage, because how can they have the highest number of persons infected and then they're like one of the lowest when it comes to death rate. Now, we, as a matter of fact, I think the more we wait, the higher the numbers. Now, I don't know what we need to do. That was why I started the show on that note, that what is it that we are not doing well? Or what do you think we need to do to curtail all of this? Is it that they need to speed up on, the rate of numbers or the numbers of persons they test in a day? Or what do we really need to do, Dr. Vat?
Thank you very much. The questions are multifaceted. I think I could pick out three things from what you asked. Number one is, why is some countries, despite having a large number of infected individuals, they still have a very low death rate. Okay, so that's one. Then number two, what can we do to curtail some of
your
the
people are already calling?
Ugochi from Lagos. Ugochi, good morning.
Good morning.
How are you doing, Day?
I'm fine.
All right, yeah. So what's your question for the doctor?
Yes.
Go on with your questions.
Like, our question is, how are we, like, what and what are we going to do to prevent this coronavirus?
Okay.
Thank you very much. Okay, so number one, what we need to do at this time is to obey the government agencies' directives. We should obey all that governments are telling us to do, starting from the federal government down to the state government. If they say we should stay at home, we should ensure that we carry out such instruction to the letters. We should stay at home. That's number one. Number two, we should maintain good hygiene, good respiratory hygiene. When you're coughing, of course, it's now a common place for us to, each and every one of us to put on face mask. I'm happy that it doesn't have to be medical grade face mask, just like the one we are putting on at the moment. We are beginning to see plenty of face masks of all sizes. In fact, it's becoming to be fashionable.
Yeah.
Yes. We see.
Good.
Okay, you can see some of them displayed on our screen. Okay, so there's nobody that will give an excuse. We are not just dependent on the donor, international agencies, other countries of the world to donate to us. Africans, our ingenuity is beginning to come out. We are beginning to also help ourselves. We don't have to always go cup in hand begging for aids from foreign countries. So we are beginning to assist ourselves, and that is commendable. So if you can't lay hands on what we are using at the moment, you can actually get the ones that were shown to us a while ago, okay? You can get them. It can be washed in with soap and warm water or hot water, and of course you sun dry it or use an electric iron to dry it, and you can wear it the next day. So no excuse not to have face mask. Okay, but this face mask must not be worn in isolation. We have said that repeatedly. You must also ensure that you also maintain social and physical distancing. You must ensure that at all times that the distance between you and the person next to you must be at least 2 arms length from each other.
Can see.
Okay? Some people say 2 meters, 2 arms length from each other. Okay, so that will enable you so that when you cough or sneeze, because now we are beginning to see community transmission and asymptomatic and pre-symptomatic carriers. These are individuals who may have the disease and yet they are showing no symptoms, but still have the capacity to infect people around them. Okay, so one of the things you also need to do is to wash your hand regularly under running water for at least 20 seconds. Okay, in a situation where you can't do that, where water is not available, you can use your alcohol-based sanitizers that should have at least 60 to 70% of alcohol content in it. Okay. Apart from that, we also need to disinfect hard surfaces around us. The door handles, our car handles, and what have you. So we need to disinfect as much as possible. In my own facility, I instituted a measure that should be done every 2 hours.
Good. Hilary, good morning.
Good morning, ma.
How are you doing, sir?
I'm good. I have a question about this health stuff.
All right, please go on.
Why is the face mask costly to buy? Good morning, ma.
Why is it expensive, Abi?
Yeah,
Right,
the answer is obvious. Simple economics, yes, teaches us that when you have, it's just demand and supply. So when you have a lot of demand, a higher demand for a particular product, of course, the other market interplays will come in. It's likely the prices will go up. But that's not alone. The fact that all the countries of the world are beginning to do the same battle at the same time has brought about worldwide scarcity for those medical consumables. So it is even not available from anywhere.
But then we have the African made now.
Yes, but we have the African made. That's where I'm going to. So yes, it used to be costly, but I want to believe not anymore, because now we have alternatives. Now we have options. And of course, you can see our leaders are leading by examples. If you take a look at the PTF daily briefing, you discover that people now are beginning to wear the ones that actually match their clothes. It's becoming fashionable. And of course, that will encourage more people to know that this is a necessary step that we all need to take. Because if I wear face mask and she does, if I have, and I happen to be an asymptomatic carrier, anything I put out by way of speaking or coughing or sneezing stays with me. So that way I don't infect her, and that way she doesn't infect me. So it's among the major preventive steps that we need to take as a people. I'm happy a number of states in Nigeria have made it mandatory for all the people living in such states to wear face masks. I also read this morning that by 1st of May, Ogun State will make it mandatory as well for everybody in Ogun State to begin to wear face masks. And Lagos State has also been on the front line. Mask Up Lagos, okay? I saw that trending on the internet. So it's a necessary step that we all need to take. You don't need to depend on what we are putting on. The medical graded ones, they're expensive. The locally made one, you can actually do one yourself. You can get a white handkerchief, and then of course go to YouTube. You can see how it can be folded, and with snake on either side of it, you're good to go. So the fact that it was expensive shouldn't be an excuse anymore. not for anybody.
Okay.
Now, going back to your question, let me take the first one. How come some people with higher number of affectations still have lowest,
death
even
rate.
much higher than the people below them? I'll use Germany, for instance. In the whole of Europe, Germany, despite the higher number of affectations they have, just like every other major countries in the Europe, the number of deaths in Germany is still the lowest. That can be read in a number of ways. You could see it as a country that has one of the best healthcare systems. It stands to reason. Because it's the management of cases that actually will bring about the number of people that will survive. Among the critically ill patients, though, don't forget, we have said that countless number of times, that 80% of people who may be infected with this scourge may recover by themselves, with or without any form of hospitalization. But usually, this set of people are isolated for a reason, so that they don't infect others. We have Dennis from Lagos.
Good morning, Dennis.
Yes.
Good morning.
Good morning.
How you doing?
I'm doing well, ma.
All right, there. Good to have you on the show. Please go on with your question.
Okay. My question is this: How do we get the statistics of this testing that you always give us to understand? It is by house-to-house test, or how do you do it before we arrive at all this total of testing, which you always give?
Do you understand?
Okay, yeah, I think I understand you. Thank you very much. Now, what happens is that at the moment, Nigeria has about 13 testing centers scattered across Nigeria that are capable of working independently. About a month or two ago, we had only 4 or 5. Okay, but we've been able to ramp up efforts. We've been able to step up our game. And currently, thankfully to the wonderful work that ACCDC and the Presidential Task Force and the federal government are doing, we now have 13 testing centers across Nigeria. And Lagos has the highest number of testing centers. They have about 3 to 4 testing centers in Lagos. Also, Lagos, of course, being the epicenter, the governor of Lagos State has taken a number of initiatives that have actually helped to stem the tide, that actually helped to flatten the curve. Okay, I will tell you why. Lagos at the moment has about 26 sample collection centers, okay, that are scattered all over the local government. So you don't need to go to IDH, Yaba, to get tested anymore. You can go to the nearest center to you. What you need to do is to actually register online, because it has to be by appointment. I don't know if that has changed. So when you get there, if it is your turn, going by the appointment you may have received, when you get there, and of course, let me also point out that it must have to be in line with the case definition that we presently have in Nigeria. So it's not like everybody can go straight up to say, I want to be tested. Okay, so there are some criteria that one needs to fulfill. Okay, so those centers, what happens is that when you get there, your samples will be taken. Not that the test will be done in those centers. Okay?
Just take the samples.
And then the samples will be sent to those central labs that have the capacity to do the test, because it's not RDT. Okay, but I do know that in some parts of the world, they have mobile testing centers. In South Africa, as of the last time I read about it, they have over 67 mobile testing centers. I'm hoping that someday we'll be able to get there. Okay, so that is how it's tested. Now, the figures, how do they come about? What happens is that they wait. You discover, if you've been following what has been happening with the SCCDC, you discover that figures are actually released late in the night, because they have to wait for other testing centers in some other states to send in their result before they will do collation and, of course, give us the figure that we usually see. That accounts for the reason why it usually comes at night. Okay, so back to your question on what we need to do as a country. Number one, we need to find a way of curtailing the community transmission that we are currently battling. And of course, that battle will be fought by each and every one of us, not just the people in government, not just the policymakers, in the sense that there are aspects that we need to do, okay? As members of the community, members of the Nigerian community, there are aspects that we need to do. If they ask us to stay at home, we need to do that. Currently, I'm not seeing, we are beginning to see a lot of people disregarding, and I cannot... In as much as one wouldn't want to make excuses for that, times are hard, the lockdown it's been difficult for a
yeah.
number of families. So it's a difficult battle. But I will still encourage us to do the little we can, to do the best we can. Yes, it may be a time for us to put in 1 or 2 little efforts. It may be a time for us to endure 1 or 2 things, but let's do it to save our future. Okay, because if we get to a level, let me also give you an idea of the model that WHO gave about Nigeria. Not Nigeria, about the whole of Africa. The model they have for Africa talks about having a number of people in the neighborhood of 9 to 10 million infected in Africa in the next few months. That number is alarming. We shouldn't get there. Okay, so I listened to the regional director of WHO in Africa, Mashistiso Moeti, okay, talking about that Africa, COVID-19 will have profound consequences in Africa. And if you look at some of the things she's saying, they have reasons for putting the facts on the table. It's to encourage us to step up our game, okay? A while ago, I talked about the fact that about 10 countries in Africa, that information was from NCDC African director, I think John Nkesango, something is his name. Okay, so that information was credited to him, that he said about 10 countries in Africa are still without a single ventilator at the moment. And of course, that is what you need to manage critically ill patients. Okay, so you can imagine if we start having the type of figures that we are getting in the Europe and America, and we don't even have ventilators to help out people who cannot breathe on their own. Of course, the number of fatalities will be sky high. You don't need anybody to tell you that. Okay, so we need to do our own part, not just depending on government to do everything for us.
For us, right. Okay, I'm sure a call is coming through, but before, okay, let me just take it and ask. Isaac from Lagos. Isaac, good morning.
Good morning, madam.
How are you doing, sir?
I'm very fine, ma.
All right, please go on with your question for today.
Okay. My question I want to ask from...
Go on.
We can hear you.
Okay, good morning, madam.
Good morning, good morning.
I'm very fine.
Okay. Can you go on with your question, please?
According to the news, we've seen that there's no cure for now.
Yes.
But how come people are getting recovered? There's no drug for the cure.
Okay, let's see why.
Okay, thank you very much. Like I said a short while ago, it's not everybody that picks up the infection that will come down with severe disease. So about 80%. Suffice also to say there are still a lot of unknowns about this pandemic, about this infection or scourge or contagion. Okay, so about 80% of people who may pick up the disease will recover by themselves with little or no help, even without getting hospitalized, even without getting admitted. But the reason why they are being admitted is that they need to be taken in isolation to avoid allowing them to infect people around them. Okay, so it's only 20% that may come down with severe disease. Among these individuals that will come down with severe disease, some of them, the infection may progress to the level of viral pneumonia, which of course has no cure. Okay, that is not to say that the people who are usually taken in isolation are just being kept there. There are something in medicine. There's what we call symptomatic management. Okay, if the person has diarrhea, you give some fluids to resuscitate the person. Okay, if the person has fever, you give some analgesics to bring down the fever. Okay, so there's some form of treatment that you still need to have if you're infected. Okay, not just, yes, it cannot be cured, but all other symptoms that such a person may be presenting with will need to be taken care of. Otherwise, if you leave such a person to become dehydrated, he could die of dehydration.
Okay. Doctor, this morning, one of the papers actually mentioned malaria having something to do with COVID-19. So what do you have to say about that? Is it that if you are easily prone to malaria, it is an avenue of you being infected with the virus, or what? Yeah,
we do know. Thank you very much for that question. I think today is even World Malaria Day.
Oh, really?
The COVID-19 has actually taken our attention. And that is what WHO is saying, that we shouldn't lose sight of some other illnesses that we have in this part of the world. We should still try and sustain efforts along those lines so that we won't be trying to save one, and of course we start losing from the other end. Apart from malaria that she mentioned, we do know that there are some risk factors, if I may use that word, that can actually put one at a disadvantage at this time. One of it is age. Okay, another one is if your age bracket happens to be between 70 and above, you're not expected to be out at this time. If you stay at home and truly stay at home, because if you get infected, recovery may be a challenge. That is not to say that some elderly ones do not recover. Apart from that, we also know that people who have some pre-existing medical conditions, we refer to them as comorbidities in medicine, like diabetes, hypertension, asthma, cancers, people that have undergone transplant, they are at a higher risk. Malaria too will predispose one to be on a higher risk.
Indo BC.
ND from Ebonyi State.
Good morning, sir. Please go on.
So that is the question I want to ask.
Hey, ask
Go ahead,
we are
sir.
waiting.
Good morning.
Good morning, my brother.
I have a question to ask.
Go ahead.
You know, as our medical doctor cannot find the solution of that epidemic disease that causes sickness, I think we need to put it on prayer, not to shock the Church of God. I think that God will be angry for us, too, and it will be go worse.
I don't know.
Thank you very much. Thank you. What he is pointing out is the importance of prayers, importance of prayer in the whole. I think we are known to be a very religious country. We pay so much attention, okay,
To religion.
to religion. Okay, so we pray and intercede at all times that God should help us to find a cure. Okay, so that's also part of what we need to do. Okay, while the people in the medical aspect are doing their own, everybody should also be helping out. It could be in form of prayer, it could be in form of obeying the directive and the advisory that government are issuing. Okay, so that's all I can say along that line. Okay, so I want to read out, because I talked about the virtual meeting that happened yesterday. I just want to read out one or two things. Okay, world leaders have rallied around the United Nations for an initiative to help the most vulnerable countries gain access to vaccines, diagnostics, and treatment tools for the coronavirus as soon as they emerge. Okay, the World Health Organization chief Tedros Adhanom Ghebreyesus said the agency is teaming up with countries and partners worldwide to accelerate work on drugs and a vaccine for COVID-19, the disease caused by the coronavirus. Africa's coronavirus cases have surged 43% in the past week, but its countries are dangerously behind in the global race for scarce medical equipment. 10 nations have no ventilators at all. John Nkengasong, director of African Center for Disease Control and Prevention, said the continent is competing with the developed world in terms of obtaining supplies and equipment. The very future of the continent will depend on how this matter is handled. We are beginning to help ourselves.
Yeah,
at least for face masks, we don't need to do importation for the face mask that our community members should use. Let's just allow the medical workers utilize the few medical grades we have in our society, and of course, make do with the locally made one. That is a way of helping ourselves.
Yes, that is a way of helping ourselves. And please do not forget to still show love for those persons we know get. You know, you have in surplus, we show love. Thank you so much, Doctor.
So we see you next week. Thank you for hooking up.
Yes, see you.